Uterine fibroids, or as called medically myomas, is a common disease of the female genital tract. Usually it affects women at her late 30s, early 40s, especially if she doesn't have any children. In fact, fibroid uterus runs in families together with benign breast tumors. Usually, or most of the cases of fibroid uterus, as we say, are asymptomatic. That means that the patient does not complain of anything, and these are discovered accidentally during her checkup or during doing ultrasound for problems related to digestion. The fibroids are of different types and of different locations, and the treatment mainly depends on the need for doing surgery. Meaning that if the patient has excessive bleeding with her periods, especially if it's not responding to treatment, we have to do surgery. The same goes if she feels pain, discomfort, or heaviness. If the patient wants to get pregnant, we have to be very careful, because we have to make sure that this fibroid causing problems related to the possibility of getting pregnant. Because if there is a small fibroid away from the cavity and the tube, we usually ignore and advise the patient to go ahead with her plan to get pregnant. But if this fibroid is inside the cavity, we have to do surgery, and luckily enough, nowadays we do endoscopic surgery through the cervix without having to open the tummy. And this conservative surgery is a one-day procedure, and it's very effective. We can take out the whole fibroid through the cervix simply, and the patient can get pregnant right away. If the fibroids are multiple, meaning that we have more than one fibroid, or that the fibroid is large in size, more than 5 centimeters, in this case we have to do surgery anyway. The surgery is what we call the restorative surgery, is aiming at getting back the uterus in its original shape and removing all the fibroids there is. But if the patient is above 45, her chances of getting pregnant are reduced. We usually do subtotal hysterectomy, especially if the fibroids are multiple or causing problems to the lady, or degenerated, that is run down or lost its blood supply. And in this case, the possibility of complications is more. So as a net result, any lady who discovers that she has a myoma has to consult one or more doctors to know the best way to treat those fibroids.